And now we welcome Ms. Lydia Mbevi, all the way from Kenya to join us on the stage today. She is IFC MAS Gender Team, and she's going to share with us about the role of women in promoting food fortification as change agents. Let me introduce a little bit more about you. Lydia is supporting agribusinesses to mainstream gender in their activities, including employment, investment, and expansion.
Thank you. Good afternoon, everyone. I'm a long way from home, but it's comforting to see some familiar faces. And I want to welcome you to this opportunity to talk about something we're all passionate about, food fortification. And I want to specifically talk about women as change agents. Many times as a gender expert, people think my work is about counting women, but I want to go a bit deeper and just explain what that looks like, women as change agents. Next slide. Next slide. So we will use this just to explain what I'm saying, and we'll go clockwise. We'll start with the health of women and children at the top. I think it's clear in many societies that women make the decisions about what will be eaten, what will be put on the table. So family nutrition is a part of what women do every day. And I think especially for pregnant women and breastfeeding mothers, this is a critical part, but we still have a lot of work, as you've seen from the different colleagues who presented this morning. We still need additional nutrients for a lot of the pregnant women and breastfeeding moms in low and middle income countries. And we have a big role to play in food fortification. The other one I'd like us to look at is addressing gender disparities. There's still an imbalance when we look at access to nutrition, access to healthcare in many of our societies. So engaging women will be a critical part of addressing some of these barriers and challenges that we see. And we hope to do that in the program that Natia was talking about earlier. But we also want you to think about it as you develop policies, as you implement projects, as you design projects. We want you to think about some of these gender equality issues. The third one we would like to talk about is empowerment and decision-making. We still find some harmful cultural practices. Our colleague just shared about some of the data on school feeding programs, and I noticed in poultry for low and middle income countries, there's a big gap in use of poultry products. And I want to highlight that we still have some taboos around pregnant women eating eggs in some of the cultures or communities. So we're talking about access, but we're also talking about some harmful practices that prevent women from making the decisions that will result in improved healthcare. So empowerment and decision-making is important, informed decisions based on what are the food choices that are available? How can I ensure that my family has adequate nutrients with what's available in our market? That's the kind of empowerment that I want us to think about when we look at the household nutrition and decision-making process. The other one I'd like us to look at is intergenerational impact. And I think some of our colleagues have also highlighted this when they're talking about feeding the future generations, planning for it, making sure we address the malnutrition within the societies so that we have health outcomes for our families. And that leads me to the one on community health, where we're seeing women as caregivers and community leaders. This means that they play a key role as role models, as people who decide what's going to be eaten, how it will be cooked, and influence those around them to do the same. So they become advocates for nutrition and health promotion. And then the final one that we'll look at is the one on maximizing impact at the top. This is where we're looking at how women often have valuable insights into local food preferences, how to cook, how to distribute this food. There are many invaluable lessons we could learn from women about traditional ways to store food, to produce it, to cook it. And so these are some of the things that we would want to just bear in mind, and how their active participation can promote community acceptance and ownership of fortified foods. Next slide. So I'm going to use a framework, and just to help you remember it, I'll refer to it as a vitamin D framework because they're all Ds, at least in English. And this framework is a gender smart and nutrition smart food fortification framework that we've developed. And I'll just quickly go over some of the details. So the first D, we're looking at diagnose, where we're saying, take the time to understand and address the nutrient requirements of both men and women. So if you're in the private sector, for example, look at your consumers and understand the different cohorts. And I think my colleague from the Global Child Nutrition had a very good infographic of pregnant women, children, disabled, elderly, all those different cohorts. Take your time to understand what are their specific nutrient requirements. Women have different nutritional needs. For example, an adolescent girl will have a different need than a pregnant woman. So it's good for you to target the consumer that you have in mind. The other thing I'd say about diagnosis, also do some research to understand those needs and what can be the best product. We came across a company that produced fortified rice, but when they tried it out, they liked the taste, but they didn't like the smell. That kind of thing it might not be significant, but it means uptake of that rice will not be high. And so that's what I mean about understand your consumer or understand the person that you're designing for so that you meet all their needs. Then the next D is design, where now you've got your information and you want to design a program that addresses the needs, the nutritional needs of different populations. Some of this includes looking at accessibility. The regions where there are gender-based disparities, look at those and understand what some of those are. We did a project in Bangladesh one time where we introduced nutritious vegetables, and uptake of producing the vegetables was very high, but consumption of the vegetables was low. And when we went in and tried to understand why is consumption low, we found that those who are responsible for planting were the younger women. And so when we called for training, they came. But those who decide what will be cooked at the household level were the mothers-in-law, and we were not targeting them when we spoke about the nutrition of these vegetables, how to cook, and the value of those vegetables. So that's what we mean about designing for your population. And then, of course, we have monitoring and evaluation. Keep an eye on what is the data saying and go deeper into understanding that data, and disaggregating it by sex, by age, by region, so that you can have a good picture of what it's saying. Then the third D is about delivering. So engaging with companies on improving accessibility and making sure foods are accessible to both men and women. I've seen, I remember during the Ebola outbreak, we had a cash transfer program. And one of the things we found was when the men have the cash and are making decisions about what to buy in the market, their decisions are very different from when a woman is making decisions on what to buy in the market. So even in times of crisis, we might come with a solution on what foods to provide. Make sure they are accessible to both men and women and that they can make informed decisions. Conduct education, promote awareness. I've seen in supermarkets when they introduce a new food, they have a tasting booth and you can try it out and see if you like it. And every time I'm passing there with my children want to try it out. That's creating awareness on your product. But sometimes you need to also go deeper and understand the different consumers that you have so that you can address the cultural and gender norms that impact food choices that we make. And then I would also emphasize integrate gender considerations in national policies and strategies related to food fortification. I think the moderator said that I'm from Kenya, and I was quite proud to see that in terms of policy, we've made it mandatory for a lot of our maize. Maize is our staple crop, just like rice is here. And so the maize flour is fortified. And I remember years ago when those conversations started, and it's so good to see now the results of having that as a mandatory policy. And so I'd encourage this government and other countries who are facing similar discussions, whether it should be mandatory or not. There's so much benefit in this, and the results will be seen over time. We even have maize flour that's specifically fortified with indigenous vegetables that I've seen the elderly. Like if I'm traveling to the US to visit some of my elderly relatives, this is a kind of thing I always carry because it's fortified with indigenous vegetables that meet specific needs for the elderly. So this is the kind of thing I'm talking about when we come to deliver the program or the product. Then the final one on document. It's important, this kind of knowledge sharing forum is such a valuable place for you to learn from your colleagues, hear what's going on, hear what are some of the best practices, some of the things that need to change, and share your own experience. So I encourage us to continue documenting what we're doing and sharing it when you get the opportunity. And if you can share your data, your findings, especially the ones that are specific to gender issues, that is such a valuable thing, even for governments and other stakeholders to use. So I encourage you to do that. I encourage you to go deeper, look at your data. Don't just count the numbers, but go deeper and understand why are certain regions showing this? Why are certain periods showing this? Why are certain age groups showing this? So let's go deeper. And I think the World Health Organization presentation in the morning gave us very good examples of how they've analyzed their data and how they're presenting it. I think other data that we need to think about is what is the cost of fortifying foods? What is the return on investment? And I think that was also mentioned by colleagues in the morning. So that as a private sector company, when you're thinking about this model, what's the cost implication for you? How do you benefit? And what will it translate to in terms of sales? I think when you have that data, you can make a better decision about how to proceed and which consumers to target. So those are the things I wanted to highlight in terms of gender equality and gender smart food fortification. And I'll be available in case you have any questions or if you need more information, I'll be happy to help you. Thank you very much.